Good afternoon. In today's video demonstration, I will going to demonstrate the routine procedures of the femur, namely the AP projection, and the lateral, specifically the mediolateral projection of the femur. Good afternoon, ma'am.
Afternoon, sir.
Please sit down po. By the way, ma'am, I am Jonah Pulgo Ikoy and I am your red tech for today. May I know, ma'am, kung sa imong language preference po?
Bisaya, sir.
Noted po, ma'am. Ma'am, mutanak, ma'am, ha, for patient confirmatory. If I have the right patient, ma'am.
Okay.
Ano sa yung middle name niyo, ma'am, date of birth, and your age, ma'am?
Pulgo, sir. Then, 18 years old po. Tapos, August 3, 2003 po akong birthday.
Sige po, ma'am, thank you. Ma'am, tanong ko, ma'am, if buntis ba ka karon?
Dili, sir.
Kano sa last nimo ma'am, gidugo?
Last month po.
Ma'am, ano di ay nagpa-x-ray ka, ma'am?
Sa kung right nga leg.
Sa imong, okay, right legs. Mo ni ma'am, femur kani, diri banda?
Opo.
Sige. Right, ma'am, no?
Opo.
Then, ang nakabutang sa imuhang kuan ma'am, no, is right. O throw na ka, ma'am, ha? Right leg.
Opo.
Sige. Right femur. Then, before tamo proceed sa itong procedure, ma'am, natay patient gown dito, ma'am. So, ato nang gamiton, ma'am, isuot din. Ang pagsuot niya, ma'am, is nasa likod ang pagkot. Then, tanggalin na to atong mga metallic objects, ma'am, like ginabutang nimo diri ba, na ba kay mga metals diri ginabutang sa kuan, sa imong legs, o sa imong diri sa imong thigh.
Okay po.
Sige. Wala man, ma'am, no?
Wala po, sir.
Sige, ma'am. Then, ang ato di ang kuan, ma'am, examination karon kay right AP femur o lateral. So, duha ka procedure, ma'am, ha? Sige, ma'am, proceed na sa atong kuan, ma'am. Afternoon, ma'am. Ready na ba ka, ma'am?
Yes,
sa
sir.
procedure? Ma'am, mag-introduce ko sa imong lead shield, ma'am. Kani, ma'am, ibutang ato ni siya diri sa imong gonads, ma'am. Dili siya ibutang.
Opo.
Ma'am, ha, during the procedure. Then, maminaw jud ka sa instruction ako, ma'am, ha? Sige,
Yes,
ma'am,
sir.
proceed na ta sa ato ang, ma'am, sa ato ang x-ray room, sa table. In patient positioning, position the patient supine with toes up. So, as you can see, look at the patient is in supine position. Then, adjust the pelvis to place the assis equidistant from the table. So, ma'am, mag-touch ko, ma'am, ha? Basic, ma'am. The assis, equidistant sa table. Okay. And make sure that the patient femur is on the midline of the table. As you can see, so, nasa midline, assuming that this is the x-ray table. Then, in par positioning, center the affected femur to the midline of the grid. Ma'am, mag-touch ko, ma'am, ha? Okay. Assuming na nakabaki ang ato ang image receptor, then the technical factors for this procedure is 14 by 17 cassette size or image receptor size. Then the SID would be 40 inches. So, image the distal femur by placing the bottom of the IR 2 inches or 5 centimeter below the knee joint. So, below the knee joint daw is here. Palpate the patella to include the inferior sa apex of the patella is the dira ataman ang atuang collimation. So, since our patient is ma-include na to ang both proximal femur and the distal femur kay mubo man ihang ayang femur, so ma-include na to siya. So, apply the gonadal shield. Then do not forget to rotate the extremity internally to place it in a true anatomic position. So, instruct the patient, ma'am, Paki-rotate ko sa imong mag-rotate ko sa imong tail ma'am ha, 5 degrees. Rotate internally. So, in true AP position na ang atong AP, ang femur. So, the next procedure is the central ray. The central ray must be perpendicular to the mid femur and center to the IR. Since we've already centered the femur to the IR, so the central ray must be centered to the mid femur. So collimate, including the knee joint and the proximal femur and the distal femur. So assuming that we've already collimated it tightly, then in collimation, 1 inch or 2.5 centimeter on the size of the shadow of the thigh and 17 inches or 43 centimeter in the length, place the side marker in the collimated exposure field. Place the marker here. So assuming that we've already collimated it tightly, then instruct the patient to do not move or make another unnecessary move. Ma'am, ayaw lihok ma'am ha. Then, shoot. For the structure shown for AP proximal femur projection, we can see the femoral head, the greater trochanter, the femoral neck here, the lesser trochanter, the femoral shaft, the obturator foramen, the pelvic brim, and the ischial spine are clearly demonstrated in AP proximal femur projection. For the criteria evaluation for AP proximal femur projection, the image brightness is uniform across the femur. The ischial spine is aligned with the pelvic brim, as you can see here. The obturator foramen is open, as you can see. The femoral neck is demonstrated without foreshortening. The greater trochanter is in profile laterally, as you can see here. The lesser trochanter is completely superimposed by the proximal femur. Long axis of the femoral shaft is aligned with the long axis of the exposure field. The proximal femoral shaft is at the center of the exposure field. The proximal femoral shaft, hip, and surrounding femoral tissue are included within the exposure field. Then, 2 inches or 5 centimeter of the overlap is evident with the distal AP femur projection if the interfemur is imaged. The next procedure will be the lateral femur, or specifically the mediolateral projection of the femur. As you can see, in patient positioning, position the patient on the affected side with the knee flex about 45 degrees. So, nakasupine siya, ma'am. Tagilid ka gamay, ma'am. Touch ko, ma'am, ha. Anak, ma'am. Then, your heel. Then, dili tayo sleep ka gamay, ma'am. Anak silang asa sa anak. So, in this position, tagilid ko, ma'am, anak, para matulala ka rin siya. Then, ka na, ma'am, anak. So in this position, the patient positioned in for the distal femur. In this position, the patient the target for position when the patient is positioned like this is the lateral proximal femur. So, since naka-true lateral position na atong patient, adjust the femur so that the epicondyles are perpendicular to the tabletop. So, the femoral epicondyles are here. So, we've already know that the patient is in true lateral position. Then place the bottom of the IR 2 inches or 5 centimeter below the knee joint. Then apply the gonadal shield. Ma'am, talihog anak, ma'am. Na. Then, the central ray for this position is centered on the mid-femur or perpendicular to the proximal femur man siya. So, include the proximal femur, the head of the femur. Then, instruct the do not collimate 1 inches on the sides of the shadow of the thigh and 17 inches or 43 centimeter in length. Place the side marker and the collimated exposure field. So, make sure that it does not superimpose with the anatomy being demonstrated. So, instruct the patient to do not unnecessary movement, and assuming that we've already collimate it tightly, then shoot. Assuming that our patient have worn patient gown, so for the imaging of the distal femur, position the patient in this position. So ma'am, ana imong tiil diri nan. Ana. Flex yung tiil nan. So, the central ray is the same with the proximal femur projection. However, the difference is we've already included the distal femur. So, the knee joint will be included in this projection. And do not forget to put the image, the lead marker. Then, instruct the patient to do not move. And assuming that we already collimated it tightly, then instruct the patient to do not move. Ma'am, ayaw lihok ma'am. Then, shoot. For the anatomy demonstrated or the structure shown for proximal lateral femur projection, as you can see that the femoral head can be clearly seen, the greater trochanter, the femoral neck, the lesser trochanter, which is medially seen on the resulting radiograph, the ischial tuberosity, as you can see here, and the femoral body or the mid shaft of the femur. For the criteria evaluation for proximal lateral femur projection, the image brightness is uniform across the femur, as you can see on the radiograph. Lesser trochanter is in profile medially, as you can see here. Femoral neck and head are superimposed over the greater trochanter. Femoral shaft is seen without foreshortening. Femoral neck is demonstrated on the end. Greater trochanter is demonstrated at the same transverse level as the femoral head. The long axis of the femoral shaft is aligned with the long axis of the collimated field. Proximal femur shaft is at the center of the exposure field. As you can see, the proximal femur shaft, hip, joint, and surrounding femoral soft tissues are included within the collimated field. Then 2 inches or 5 centimeter of overlap is evident with the distal lateral femur projection if the entire femur is imaged. For the structure shown for distal femur, lateral distal femur projection, we can already see that the femoral shaft can be clearly seen. The lateral epicondyle, the medial epicondyle, and the patella are clearly demonstrated, as well as the tibia and the fibula. Then, for criteria evaluation, the image brightness is uniform across the femur, as you can see here. The anterior and the posterior margins of the medial and lateral femoral condyles are aligned. That long axis of the femoral shaft is aligned with the long axis of the collimated field. The distal femur shaft is at the center of the exposure field, as you can see here. The unaffected leg is not demonstrated on the projection. The distal femoral shaft surrounding the femoral tissues, knee joint, and 1 inch of the lower leg are included within the exposure field. Then 2 inches or 5 centimeter of overlap is evident with the proximal lateral femur projection if the entire femur is imaged. For the structure shown for the distal femur, AP distal femur, since I forgot to explain the structure shown in the criteria evaluation for AP distal femur projection, for the structure shown, we can already see the medial epicondyle, the medial condyle, the lateral epicondyle, lateral condyle, femorotibial joint and femoral shaft are clearly demonstrated in this AP distal femur projection. And for criteria evaluation, the image brightness is uniform across the femur, as you can see here. The femoral epicondyles are in the profile. Femoral condyles are symmetric in shape, as you can see here. The tibia superimpose one half of the fibular head, as you can see here. Then, the long axis of the femoral shaft is aligned with the long axis of the collimated field. The distal femoral shaft is at the center of the exposure field. The distal femoral shaft and the surrounding femoral soft tissues, the knee joint, and 1 inch of the lower leg are included within the exposure field. Then, 2 inches of 5 centimeter of overlap within the proximal AP femur is evident if the entire femur is being imaged, as you can see. Good afternoon, ma'am. Done na po atong procedure. And then, ma'am, by the way, pakibalik ang kanang patient gown, ma'am, is pakihang dito sa hamper, ma'am. Palihog na lang ko. Then, ang result dahil, ma'am, is 2 to 3 hours na po siya. Thank you kayo sa pagpamino sa instruction, ma'am.
Thank you, sir.
Sige, ma'am. Thank you.